Good evening, and welcome to the WHCP Radio 101.5 FM to the Cambridge Community Conversation. Tonight, we're going to be talking about COVID-19, where it stands, the number of tests, cases, and deaths in our community and in our state, and coping strategies. Tonight, we have two experts. They appear for the second time. They were here in May, and now they're back again to answer your questions. First, we have Roger Harrell, who is the health officer for Dorchester County Health Department. He's a graduate of the University of North Carolina at Chapel Hill and the Medical College of Virginia. He is active in the community and on several boards, including Coastal Hospice, where I first met him. Our second speaker is Dr. Casey Scott. She's the Deputy Health Officer for Dorchester County Health Department, and she received her medical degree from the University of Maryland School of Medicine. She got her master's in public health from Johns Hopkins Bloomberg School. We would like to welcome them, but first we have a couple of housekeeping notes. We would like to thank our sponsors and the organizers of the Cambridge Community Conversation. First of all, there's WHCP Radio, the Cambridge Association of Neighborhoods, the Dorchester Banner, and the Dorchester Chamber of Commerce. With everybody's safety paramount, everyone here today in the studio is socially distanced or they are appearing remotely. We would like to thank tonight's question analyst. That's Angela Grove. She's in our anteroom, and also our technical director, Julian Jackson. And of course, the station manager, Mike Starling, who makes all of this possible. I'm going to turn it over to our keynote speakers tonight for their introductory comments. Roger, would you like to lead off?
Yes, Glenna, thank you very much. I'm so pleased and happy to see you this evening. It's been a while since we've been together, since you were on the board at Coastal Hospice. So thank you for your community work that you do. I feel at home. I'm back here in Cambridge Matter Studio A in beautiful downtown Cambridge. So last time we were here was on May the 20th. It's been about 98 days since we were here last. A few statistics at that point. There was 7.5% of Dorchester County citizens had been tested. That was 1,502. As of through today, we're at 8,837. Which is a much greater percentage of the population that we have tested, around 26%, I guess. That's an additional 7,335 citizens that we've tested, a lot of them at the Dorchester County Health Department. That doesn't indicate how much testing we've done because we test some folks from outside the county. So what I'm giving you are statistics for our county. We had at that point 122 people that were positive in Dorchester County. Today it's 430 for an increase of 308. So what's happened over the 98 days? Well, we were just getting ready to, the stay-at-home order had just been lifted by the governor. We were beginning to figure out how to do outdoor dining. The glitch, though, was we still had no more groups than 10. You couldn't have more than 10 people in a group. Well, lo and behold, since then, we've had additional 4 executive orders, the latest one being on 7/31. We have a travel advisory from the health secretary. We have, at that point when we were here, the treatment testing was not a lot for trying to figure out treatments that were adequate for treating this virus. There are now 18 of them in different phases. Vaccines, there's 7 different companies that are running studies today. So a lot has happened. We opened playgrounds. And as I said, we really put a focus on testing in our community, other than I think the last time we were here, we were finishing up our testing with one of our major employers, which was Amick Farms for poultry. So Glenna and group, thank you again for the opportunity to be here. Thank all the sponsors. Michael, thank you for what you're doing for this community. And I'll turn it over to my partner in crime and my Deputy Health Officer, Dr. Casey Scott.
Thank you again for having us back. last time I was broadcasting from home. I kind of like being here in the studio with you guys. So thanks again for letting us come out and give you guys an update. I'm just going to review the most recent statistics for our county. Again, quick plug, this information is available on our dorchesterhealth.org website. There's a link to COVID-19 information, as well as on our emergency preparedness Facebook page. We post this every weekday, sometime between 4 and 4:30. So as of 8/26/2020, we have 451 total confirmed cases in Dorchester County. We have 27 active cases, and that means those are people who are still on their isolation that we are continuing to follow and call every single day. We've had 5 deaths to date, and we currently have 5 patients hospitalized. I think if I were going to try and summarize what the health department has done, or what's kept us busy from May 20th until now, it would be one word: testing. We offer testing twice weekly. We have a testing schedule that now goes through September. That's not something that we were able to do early on in the course, but it's something that we've really taken head on and we take very seriously. And we want to make sure that we are available to test anyone who wants to get tested, no matter where you live.
Thank you very much. Roger, I have a question for you. There seems to be some confusion about the effectiveness of masks and social distancing. What do you, as the expert, think about what the best practices are on these controversial topics?
Well, first and foremost, wearing a facial covering of at least 2-ply or 3-ply makes a difference. And we're wearing our face coverings to benefit our community and our fellow citizens. That's why we wear them. They've been proven to be effective. Are they perfect? No, they're not. I'll ask when I finish, I'll ask Dr. Scott to weigh in from a medical perspective as well. But these are the basic things. The other one is social distancing and keeping 6 foot apart, as we were discussing earlier with you and Dr. Scott and I were discussing, does make a difference. And these are the basic remedies. And going along with that is the third tier of this, and that is sanitation and washing your hands often. Dr. Scott, would you like to roll in and finish it up from a clinical aspect?
Sure. So when my kids started going to preschool, they were taught to cough in their corner. And I thought maybe that meant they were told to go in the corner and cough. But no, they showed me, you cough in the corner of your elbow. And that's like the most basic form of hiding those respiratory droplets that can come out of your mouth when you cough or sneeze. So if we're telling people to do that at baseline, and now we're trying to prevent those respiratory droplets that have viral particles in them from spreading, the best way to do that is to cover both the nose and the mouth with a mask. Are there different types of masks out there? Yes. So we're talking about a face covering that definitely covers your nose and your mouth. Roger mentioned the thickness of it. It can be a cloth mask. It could be a surgical mask. Really, any mask is pretty good. The only thing the CDC has come out to say recently is that it probably should not be one that has a valve on it, because that valve can allow the droplets to leave the person wearing the mask. So it's not actually protecting the people around them. But really, any other type of face covering would be fine and appropriate, and would allow you to have a little bit more protection than if you weren't wearing one at all.
Thank you. Dr. Scott, you mentioned school children. And I know many in Dorchester are disappointed that DCPS, the public school system, has decided not to open for in-person instruction. Do you have a reaction to that?
Well, we've been working with the school system on their plans ever since all of this started. I know that Roger and Mr. Bromwell, the superintendent of schools, have a great working relationship. I've in fact been the past 3 days been going around and talking to the teachers who are now reporting back to school and working in the building to educate them on COVID. I think a lot of those decisions were made to kind of cut back and go virtually because we started to see an increase in numbers around that time, in that mid-July, late July timeframe. I think it's important to know that none of these decisions are easy to make, and they're all taken, there's a lot of decision making and a lot of planning that goes into this. So none of these decisions are taken lightly. Roger, did you have anything you might want to add on that?
Yeah, just a couple of points. One being that we worked cooperatively over the summer with Mr. Bromwell and his staff, in case he was involved, and some other folks looking at the health and safety plans, what if scenarios. The key question here, though, is that we ask is what will it take for Dorchester County Health Department to support a return to in-class instruction? And as it stands today, we're looking with the Maryland Department of Health leadership, the governor's team of public health experts, the superintendent of schools, to figure out what the metric should be to say when we should open and bring folks back into the classroom. We did do some planning and looked at, say, what if, could we do it? But we weren't basing it on a metric. So those metrics will come out within hopefully the next couple of weeks, which will give us a barometer, and it's going to have some high, low to medium to high risk. And that's how we will be looking at it. It'll be a model that we can look at and then talk about whether or not we can do, as some of the schools on the Western Shore has talked about, is maybe into late fall, November, so going back to the classroom. But today we're not ready to do that, and we don't have the metric that the system would give us to do. So more to come on that.
Thank you. So we've seen that you're doing lots of testing in the parking lot of the health department there behind the McDonald's. And so I understand that you now are using a different kind of swab. Can you tell us, are they better? Are they more effective?
So I'll take that one.
Okay.
You got it.
So you're right. So we have actually done a few different types of tests at the health department. We started out doing, I think our first mass clinic was at the very end of May in the Harrell Elementary parking lot. And we were doing a self-collected, we call a mid-nares swab with a Q-tip. We've done that type of a swab. We've done what we call a nasopharyngeal swab, where a nurse collects from a much deeper place in the nose. And then we've done an oral swab, very similar to when you get swabbed for strep throat. All of these swabs are effective in detecting COVID. It's important to remember that we get all of our testing supplies and kits directly from the State of Maryland Public Health Lab. And the directors of that lab vet all of these supplies to make sure that they are reliable and accurate. So that's why it changes. Sometimes some clinics will have one type and some clinics will have another type. We get a shipment from the state public health lab, and sort of we use what we get sent.
Thank you. We have a question from one of our audience members, and he's referring to the news that came out today that the CDC is no longer recommending testing for individuals that have no symptoms, even though they may have been in contact with someone who tests positive for the virus. Do you have a reaction to that?
I can take that one too.
Okay.
So I saw that headline today as well. So thank you, Thomas, for your question. So something that maybe not a lot of people are aware of, but let's go over a scenario. So let's say we have a person who tests positive, and that person's wife, who they live with, is now named as a contact. That contact is told to quarantine for 14 days. If that contact, the wife, decides to go get a test, which certainly she can do, if that test comes back negative, she still has to quarantine for 14 days. So I think there was some confusion across the country, really, as to can I basically test out of having to quarantine? And the answer to that is no. So my initial reaction to this is that I feel like this is their way of simplifying that information. We will not change our strategy here based on that. The wording that I saw, in fact, was, if local and state public health officials encourage you to get tested, please continue to do so. So we will test you no matter of your contact status or your symptom status.
Thank you, Casey.
Glenn, if I could interject on that, and
sure.
Thank you, Tom, for that question. He and I've had this offline discussion several times regarding that. He's always very interested in what we're doing. What we are trying to do right now is test as many folks as possible. What we need to determine who is positive. We need to be able to isolate them, contact trace them, and be able to manage them and demonstrate that we can do that so that our hospitals will have enough beds, ICU, et cetera. So there's a method in order for us to mitigate this virus with not having a treatment and or a vaccine right now. It is to test as many people we can and demonstrate that we can monitor them. We can get them out of the general community until they recovered and come back. And that way we can be assured that if we do open up more, that we have the capability of managing the population. That's the key to testing and contact tracing, which I think, Casey, we're going to talk about a little bit later. So thanks again, Tom, for your commitment and your interest.
So you mentioned vaccines. Do you have any sense, Roger, of how soon a successful vaccine could actually reach us here on the shore?
But the update right now, the way the system will work is that we have, if you've heard this at a national level, a strategic national stockpile. Goes back to when we talked about anthrax and other things that we distribute out. There's a planning effort going on right now with the Centers for Disease Control, with us locally, with our preparedness staff, with the Maryland Department of Health staff, looking at what would happen when that vaccine comes out. We have a projected date, not firm, but they're hoping that with the first run, based upon what we're seeing now with some of the different studies, that maybe by November we would have the vaccine available. And what we'll be doing is determining the first responders, the folks the most at risk, who are on the front line every day, the ones that are testing folks, et cetera, that would get this vaccine. It'll be distributed through the network from the Centers for Disease Control down to the state level, down to us locally to administer, and we'll be setting the clinics up. Ideally, they're projecting what we today, and as was as of last week, projecting that for the general public, it looks like it may not happen until sometime to early 2021 and maybe as late as June. So we're cautiously optimistic. I think Dr. Scott has looked at some of the different studies that's going on and is prepared to talk about efficacy and how the trials work with the FDA. And I think, Dr. Scott, it'd be important for us to interject that right now.
Sure. So, right now, the WHO has a vaccine tracker that you can look at. It was published in The Guardian most recently. It's where I found it online. But right now, there are 7 vaccines that are in the phase 3 trials. And so I wanted to kind of just talk about the process of how a vaccine gets from, an idea to the market. So, it has to go through a preclinical phase where it's tested in animals. And then there are 3 clinical phases, phase 1, 2, and 3. And so obviously not every vaccine that is a thought ends up even getting past preclinical. Some stop there, some stop at phase 1, some stop at phase 2. Some stop at phase 3. We're hopeful that some can get past phase 3 and then get out into our population. So I'm, for the question that's on the screen right now, I'm most excited that this is really a global effort to find a vaccine, and hopefully more than one is available. But I do want to make sure everyone knows that even though this seems like a relatively fast process, and we're hearing these headlines, this is a fast-tracked vaccine, it is still going through the process that it has to be safe and it has to be effective.
Thank you. Well, Roger, when there is a vaccine or more than one vaccine, will it be released in waves of eligibility? For example, healthcare, nursing homes, law enforcement first?
Yes, Glenn, that would be the first phase that goes back to where we started with the Centers for Disease Control, and the way we will track that. We'll be looking at numbers. We'll be giving through the system X number of people that we know in the nursing home and the first responders, be that EMS, police, et cetera, and the healthcare workers. And that will be our first phase. And they'll come in, as I said, hopefully starting somewhere toward the end of the close of the year if all things goes well. And then, and what we don't know now either is if it's at 1 or 2 doses. I don't know, Dr. Scott, if you've seen anything recently, it looks like it may, depending upon which vaccine it is, it may take 2 doses. So we'll be putting in place, once we get that vaccine, a schedule of how we're going to vaccinate. We already have that in place for preparedness and pandemics already. We have plans at the health department how we would vaccine a large population, and it goes back to some of the work we did early on after 9/11 and anthrax and smallpox, and et cetera. So those plans are in place, and we would just put those forth and work with the community to get it done.
So Dr. Scott mentioned that there were 7 vaccines in phase 3 trials. Does that mean when they do come to market that people will have to make a decision about which one they think would be effective?
So I don't think that decision is going to be necessarily up to the individual person. I think that's going to be up to the medical providers, and if there are multiple different ones, like currently there might be a few different types of childhood vaccines, and it might just be that a doctor chooses to stock this brand because it's a cheaper price or because it's more readily available, or it's a combination, so it makes more sense. So I think that's going to be more of a healthcare provider organizational approach. And if there is, in fact, a choice, then that's going to be something that the patient or, our community members will have to discuss. And if that's at a mass distribution event, you'd be talking to me about it.
Okay. So this is a question for both of you. What has been your biggest personal surprise since the pandemic was declared last March?
Do you want me to go first?
Yes, you roll with that one.
So for me, I think it has been the positive, like unintended positive consequences that have come since early March, when we were slowly sort of being on a stay at home, and then I've got young kids, and they were doing home learning and things like that. I think it's really easy to get caught up in all of the things that we weren't able to do, and the things that were sort of taken away from us at that time. But it was also in those moments that I spent a lot of time with my kids that I would have never spent. I think at that point we were all really just yearning for some human connection, and we found really innovative ways to connect with one another from inside of our homes. And so I think that beauty of the human spirit really just kind of helped me get through that part. And it really surprised me how much we could look at the positive. Thanks.
How about you, Roger?
That's been a tough one for me to think about. There's a couple things. One being that, the first wave of testing positive, I remember when I was actually away. I was off. I was on a Thursday evening, and Montgomery County had 1 or 2 cases. And I think, Casey, we went how many days into March before we had our first positive case? And it wasn't because we weren't testing. We didn't have the first positive case till March 30th or thereabout. And that was kind of a surprise to me, because we were doing a lot of testing, but we didn't have people. And then once we hit that number, we were debating every day and saying, well, look, we're going to get 4 today. We're going to get 5. How many are we going to get? So that was, to me, was sort of a surprise. The other surprise was that I thought we could do teleworking with our staff. I didn't know how well it would work. As you and I discussed, Lena, early today, that getting the computers and the way for the employees and VPN connection, et cetera, for employees to work at home. We've discovered that a lot of our positions could very well work at home, and that way I can minimize the number of staff. And I think long term, it would tell you how much for office space you would need, and et cetera. So that was a personal surprise as well, is how much that telework would work and work well.
Thank you. Roger, how is enforcement going? We have a system that's complaint driven. Somebody complains about a business or groups of people, and then your office or the chamber or the state's attorney has to escalate that contact with the guidelines. Is this working, and has law enforcement had to issue any citations?
To date, no citations have been issued. Early on, I remember one case when it was carry out only, and we had a local facility that was not still doing carry out. I think we had some folks that were eating in, and it took two contacts from one from the sheriff and one from the state police, and then they decided, well, the right thing to do. That was early in the process when everybody was stay at home. We're blessed in Dorchester County, and in fact, we're the only jurisdiction. talking with the governor's office and the enforcement folks at the state level, the state police, that we have a partnership with our Chamber of Commerce. We, the health department, are members, and part of our mission is working in partnership with the community. And so what we have found traditionally, with the exception of one or two different places, that usually if we go with Bill Christopher with a complaint about a facial mask not wearing or some other complaint, that's the only visit it takes. There's been one or two businesses that took more than that. We've had to have Bill Jones at one point tell a business owner that you do X, Y, Z, and if you don't, then here are the penalties in terms of the executive order. Is it perfect? No, but it gives us that educational component. I've always believed in partnerships, and we comment each week at our Rotary Club, because Bill and I are both in Rotary, and we talk about how this is working. But we've reached a point of one or two businesses where it's down to the track that I'm getting more involved in those businesses. So it's working well. We're dependent, though, upon the community. They have to be our eyes and ears, and complaints need to be getting to the health department. We see a lot of things on Facebook that, can you validate it? Maybe yes, maybe no. So we're asking, and we'll reinforce tonight, that those complaints need to come to us at our email account, which you'll see on our webpage and our Facebook page, and or call us at the health department at the main number, so we can document that. And it's for a legal trail, so that when we do have to take it to the next level, we'll be able to do it. We've had one or two with my food manager. She's talked to a couple of facilities and gives them a 3 days to correct certain items. She goes back unannounced, and they have corrected. So we haven't had to penalize anybody yet. That's not to say that there's not somebody out there that maybe we should, but since we decided in Dorchester through partnerships, we wanted to be complaint only. We didn't think we were going to run any compliance checks. We may run compliance checks if we have a business and we have like 4 or 5 complaints that maybe after hours on a weekend, things are not going right. They're not social distancing. They're standing at the bar. They're not sitting at a table. We may have to do that. We want to avoid that, though. We don't want to have to do the compliance checks. We want our citizens and our business owners to do what they've been doing and do the right thing and protect their customers, because at the end of the day, the only way they can stay in business is keep their customers. And how you keep your customers is comply with the different executive orders that we're working on.
Well, thank you. I remember from the last Cambridge conversation about this topic that you said you were working closely with a chicken processing plant in Harrell.
Yes.
And so is that something that you're continuing to do?
We continue to work with them. I don't have my daily calls as I've had prior to that last meeting. I would say that Amick Farms and their leadership and their president has been a good steward, a good business owner, a good partner. And I think, Casey, we've seen a spot case here and there from the poultry industry, but after we did all the testing, that they've always done the right thing. As I said to the other day to someone, that they listened to us early on in the process. They redesigned it on their work lines as much as they could to social distance, to put up plastic barriers and et cetera. So Casey, I don't know if you remember any numbers recently. I remember one case several weeks back, but it's not the way it was at one point early on before we did all our testing there. We had lots of them, and what we were finding, it was that we had to give the individuals education. They would ride to work together. They would pile into the same car. They'd have a facial covering, but they wouldn't wear it when they got in the car. The living conditions. So most of the transmission was not coming within the plant. It was coming outside. And so the company did a lot in trying to educate their employees about the right thing to do when they left the plant.
Thank you.
Any thoughts, Casey?
I was just going to add on that, that's actually the trend that we're seeing now with a lot of our new active cases, is that it does tend to be members. There's like one positive within a household, and then several other members of that same household will then have a positive test. So that's one of the most recent trends we're seeing, not specifically with an industry, but in our community in general. It's household spread.
Okay. So Casey, knowing what we know now, where do you think we were caught short? PPEs for health workers, masks, gloves, sanitizer availability?
I'm not going to say no to those things, but I had a couple other thoughts.
Okay.
For one, I think it was our testing capacity. I remember sitting at the health department on March 12th when I think that might have been when we had our first case in Maryland, but we were sort of gathered, our response team was gathered and discussing what we were going to do. And we started getting phone calls from concerned citizens. Well, I've just traveled and I have this and I have that. And we had no way to test them. And, everyone at that point just wanted more information. And to not be able to deliver that, it was really challenging. Luckily, we're not there anymore, right? We have a lot of testing supplies, and we don't see a shortage anytime in the near future of being able to test people who want to come get tested. So that's one. And then the other one that I think was we sent some mixed messages about mask use, right? So early on, there was this message of save the masks for the first responders. And while that's true, right, we want our first responders, if we have to ration supplies, they're probably the ones that need it. I think if we had been early adopters of everyone wearing a mask, one, we would be used to it by now. We may not have had as much pushback as we were seeing, not necessarily outside of Maryland, but across the country. And we might be in a different place with the numbers. So that's, those two areas, I think if we could go back, I'd like to see where we'd be now if we had done those differently.
Okay. Thank you very much. Roger, talk to us about contact tracing. Have you had to hire tracers, and how successful would you say our efforts are in contact tracing?
Glenna, before I get to that, I want to comment on what Casey, I concur with her on the issue, the question. But early on, we were getting, I've heard nationally, the strategic stockpile, but the state of Maryland was getting, we were short supply in some cases. We never had that we're aware of. We sent a letter out on March the 23rd to our healthcare providers, setting a system in place that if they had a shortage of gowns or N95 masks, gloves, et cetera, that we would attempt to fill the gaps. And most times we were able to fill it. We have run shortage on gowns at times and some shortage on different size gloves. But all in all, nobody was really caught short on PPE. I think that what Dr. Scott addressed that I'm proud of is that team got together. It was the second week, Casey. The first case was in Montgomery County was a week before. The reason we are able to do the testing we do today is because Dr. Scott and my other team, led by Lanice Moan, who's our director of nursing, they started planning then and there. We were bugging Maryland Department of Health early on, saying, "Give us some kits. We're ready to roll." And we learned from what we did at the testing at Amick Farms that how we could mass produce our testing lines and get things done. That then leads, if we got a positive in the contact tracing, we got a unit of staff there already who does contact tracing for communicable disease, for STIs and HIV and others. We have added to that with staff that were on administrative leave. We have some other staff that in the summertime, they're off, some of our school nurses. And we've been able to backfill in those areas and take some other staff in the health department who were not normally into contact tracing to do that. As we go forward and we lose some of that staffing, we may have, and we've talked about hiring some contact tracers. I think all in all, and I'll point out that when the push with the governor at the state level, and you keep hearing about, you'll hear about COVID Link and NORC, which is an organization that does contact tracing. We were given the opportunity to be primary or secondary. The staff I'm proud of at Dorchester County, who does a superb job with contact tracing. There was no way we were going to let somebody from somewhere they didn't know in Dorchester County do our contact tracing. So we're primary. And on that primary, I'm proud to say that they make the calls as long as we got the proper information within the first 24 hours. They call the patients every day, and it's a team that works well together. So staffing wise, we're okay right now, but we are prepared as we move forward. Of course, as the cases go down, it means less you have to contact trace. And I think, what'd you say, Casey, active we have as today that they're still working with?
We have 27 active today.
Yeah. And that means they're being called every day. and they
And their contacts.
they have a system.
Contacts are being called too.
Yep, and they work weekends. They can work from home with their laptops. And this staff is, I'm so very proud of the staff that we have at the health department. They're dedicated. My greatest concern about my staff is, and I think there's another question about this later, is the resilience and how long we can continue to go at the pace we're going at. My constant concern is with my testing staff, and that's a lot of staff over and above, clerical staff and others, who seems to be doing well today, but we need to be concerned about the resilience of the staff and making sure they're getting some downtime. And my primary contact tracer, who was actually off a couple of days this week, which was great. So,
well, Roger, you've started to address my next question, which is, what have been your biggest organizational issues behind the scenes? Budgetary issues, political issues, the structure of your organization, or just finding qualified staff for all this extra effort?
all of those could be organizational concerns, but we're blessed, as I was talking about, with the staff that we have today, and the cross training and the way they're working well together. Beginning also with Angela, who is moderating out front for us tonight with the questions, who's done a superb job with the Joint Information Center, getting the right information out to the various sources in the community about what we're doing, along with the chamber. So the biggest concern organizationally is, once again, not burning the staff out and making sure they have some downtime, making sure we can backfill when they need to take a couple of days off. We could always say there's a budgetary issue, and yes, there may very well be, because we don't know long term what the fallout is in terms of day-to-day health department programs. And so we're now trying to get back into some of our day-to-day programs. As we were talking before, Glenna, that with the childhood immunizations, we need to catch up some of that. And so Casey, Dr. Scott, and the other staff's working on how we're going to do that. So when you pull in staff then to go run immunization clinics, but you can't have the same staff doing testing. So right now, we're doing well. Not to say we couldn't do better. We could always use more funding. Right now, we have the money that came from the feds for CARES funding that's helping us with the backfill in terms of contact tracing and others. I think the greatest concern will be going forward as to what the state revenues look like, what the county revenues look like, and what those dollars may be. And right now, we need to be talking with our school system about with nursing staff and how we're going to continue to pay nursing staff. So there are some budgetary concerns, but we'll get through it.
So this question is for both you and Dr. Scott. I mean, has COVID started giving you visions of future organizational structure that wouldn't depend so much on people needing to be in one physical place?
We think, Case. I think it is giving us some thought process, because I won't name the employee, but I have a key employee on my staff that, because of some family issues, I've had her doing telework for several years now, and saying, I need this person. I think I can give her the resources, the computer, the VPNs, the cell phones, et cetera. So that was my first example. And I think long term, if we get through this, the organizational structure in the building may be thinner than that we've had in the past. And we need that right now, because we got some areas where I can't have a lot of people in the building anyway. So it's going to be a different organizational structure. If we can get them the tools and have the staff and do the checks and balances for them to work at home. That's been and the other thing will be telemedicine, which is a whole nother scheme of how we might be able to run some clinics and do some things that we're not doing today.
So for Dr. Scott, are there continuing dangers in this pandemic that keep you awake at night?
She got that one.
Great question. So if you had asked me that back in March when all of this started, I'd answer it in yes. I mean, I think, I go back to that day that our team sort of gathered and we started, really legitimately planning for what our next 6, 9, 12, 18, 24 months were going to look like. you could feel the anxiety in the room, right? We wanted to do a good job. We wanted to serve the community well. We knew we were currently lacking some of the resources to be able to do that, but we were like, all right, we got to figure out how we're going to do it. And so, we had a lot of long nights just planning, a lot of, impromptu weekend meetings, just planning. But those things don't keep me up at night now because of how excellent our staff is and how willing they are to just take this and run with it. So when we started setting up mass testing clinics, that's something that we haven't really done in the past, but we asked for staff, if you're currently working from home and you'd like to come participate in a testing clinic, please respond to this email. And it was an overwhelming response of people who just felt compelled to serve. And I think that's the type of people that we have working in our public health department, which is exactly who you'd want working there. So I really, at this point, we're rolling with the punches. We're not really sure what's going to come tomorrow, but I have full confidence in our team that whatever it is, we'll get through it. And we'll do it to the best of our abilities and with the community at the front of our minds.
Thanks. And Roger, are there things that keep you awake at night worrying about the future?
I've had a basic philosophy a long time, irregardless of what this event is. And I was asked a number of years ago the similar question at the national meeting when rural health and public health was going through a lot of changes and fundings and et cetera. And so somebody wanted to know what keeps you up at night. And I said, well, I need a good night's rest and sleep in order to work tomorrow. So I don't I get my downtime and I need to unwind, and I'm going to have a good night's rest so I can start tomorrow anew. I've never always been able to do that in a way. And I can do it because you just heard Dr. Scott talk about the staff. It wasn't because I said that they should do anything that first weekend. They called me and said, this is what we're doing. I've always prided myself in putting an organization together and complimenting me or around me, what I do well and what they do well. As a leadership from within, with Dr. Scott, with Angela and others in our team, they just went for it. I didn't have to call and say, well, what are you doing this weekend? Well, they're calling me and said, we're planning testing. You want to come and help us? They're the experts. And so I pride myself in having a group of dedicated staff. And it goes back to the earlier, though, if one might keep me awake would be the fact that the resilience and be my concern about how well the staff needs, and they need some special, I'd say love, that's the wrong word, to make sure they know that I care about them and the work they do. And one of the things and the other difference in this group is that we have our whole senior team, including those folks who don't work on COVID every day, meet. Right now it's 3 times a week. When we first started, Casey, we were meeting every day, morning and afternoon, 5 days a week, and sometimes on Saturday, having a phone call. Is that one comment was made one day in one of our discussions, and one of the people said, well, we don't always agree, but we all like each other.
Well, that's great. So
from a team building standpoint, that's why I don't worry about a lot of sleep over that as well. But the resilience piece could keep me awake if I knew that. And I have to ask a couple of them at times, you pushing yourself too hard, are you doing too much, are you delegating, et cetera. So I have a different philosophy when it comes to keep staying awake at night.
For both of you, what about your concerns about the community? Do you worry most about bars or backyard parties or sporting events or church services?
So I can start on this one. The thing I think about is as we come into fall and holidays and just, that natural inclination to gather and now indoors, I worry that we're going to let our guard down a little bit. I think that we all like to think that you can't get it from your grandmother, or, you're not going to get it from your grandkid, but you can. And I think I worry a little bit about, what we call pandemic fatigue, right? Everyone's just tired, right? Of being so diligent and following the rules. And, you just want to let loose a little and imagine that we're not in this situation, but we are. So that's what I think about. And in trying to come at it with, education and outreach and not finger pointing and judgment, but just realizing that all of us are sort of looking at this in a different way. We're all coming at it as we feel like we have different risks, and we make decisions based on where we feel on that risk continuum. But realizing that we kind of have to respect where everyone is. And that's how we're going to get through it as a community.
Okay, thank you. Well, there is some confusion in social media about children. Can you tell us definitively whether children can carry the coronavirus, and also can they get COVID-19? There's a lot of talk about children not getting sick from it.
Yeah. So one, don't rely on social media for your medical advice, right? I tease, but I do mean that. So just to look at our numbers to date, we've had in the county 10 children test positive from ages 0 to 9 and 30 in the age range of 10 to 19. So yes, children can get COVID-19. And just to clarify again, the coronavirus is the virus that leads to the infection or the disease process that we call COVID-19.
Okay.
So they're kind of one and the same, if you will. Early on, there was a lot of information out there where, maybe kids weren't getting, we didn't see it high numbers in children. And it's a little bit unclear, were we not testing as many children, or perhaps maybe children were having it, but early on, we were only really testing people who had symptoms, because that's the number of test kits that we had available, right? We had to stratify who could get them. And remember too, back in March, we took kids out of school. So that's the number one place where they're most likely to pass germs from one another. So a lot of these early studies that were finding lower numbers in kids, we also had to kind of look at, okay, what were the kids' environments like? Were they still in an environment where they were likely to be sharing germs? There was a recent study out of Mass General Hospital that showed that kids can actually have a much higher, what we call viral load. So they can carry more viral particles in their respiratory tract than adults can. This is a pretty recent study. So I think we're sort of, there's some evidence that's gaining that says kids really aren't, they are capable of carrying the virus and spreading it among their households. But this is growing data, right? Everything that we're learning is coming out. It's new. This has been new information really since November. But I think it would be wise to sort of remember that kids can spread it. Kids should be wearing masks if they're able to, and practicing hand hygiene. And we should be sort of practicing with our kids. I've got a 6-year-old and a 4-year-old. I keep extra masks in the car just in case we need to go somewhere and I need them to wear it. We keep hand sanitizer in the car. So before they get in the car to take their mask off, we wash our hands and then we take our mask off. And before we put our mask on, we wash our hands and we put our mask on, because we don't want to self-contaminate. The whole purpose, one of the purposes of wearing a mask is also so we're not touching our mucous membranes, which is where we're most likely to get sick.
Okay. Roger, can you clarify for us what are the current rules in Maryland with regard to masks? Is this a mandate or is it just a recommendation?
And as of the July the 31st, when the governor's executive order readdressed face coverings, indoors, it is a requirement, definitely is mandated that you wear a face mask, be it an office space, a public space, any public area of a public building, you should be wearing a face covering. If you're talking to the public at any point, you need to make sure you're wearing it. So indoors, in retail shops, all the different businesses, it's now a requirement. Food service, etc. The difference in the outdoor is that if you can social distance, you're not required to wear a face mask. However, if you can't social distance, as Angela and I had this conversation today, it is a requirement that you wear the face covering. And that gets to be confusing. How do you know when you're not social distancing? And with human behavior, my druthers would be to say it would be required outside at all times. That way you don't have to think to pull it up to put it down, pull it up to put it down, because it's human behavior. But that's not, the governor's order says outside, not necessary to wear it if you're walking. There's also within gyms and et cetera. If you're not working out doing cardiovascular, you're supposed to be wearing a face covering. If you're doing cardiovascular work on a treadmill, you don't necessarily have to wear a face covering. So the bottom line is indoor restaurant, retails, public buildings, all the public areas, and the office areas when you can't social distance, and some of the businesses they can't, so they'll always be wearing the face covering. If you're in an office like I have, or the office I'm in here right now, you can see we're not wearing face covering, so that's totally acceptable. So just remember, indoor. If you're indoor, it is definitely a requirement. If you're outdoor and you're not social distancing, it's a requirement.
Thank you. So with the contact tracing that you've done in Dorchester County, what have been the leading causes of infection? Have you seen big parties or church services or?
So most recently, it's been household contacts or people who live in a household together. We've certainly seen trends over time. And, sort of around Memorial Day, 4th of July, we did see some, and people were admitting, yeah, I was at a barbecue. I was here, I was there, which were all held outside. So it is still possible to get COVID being outside at a gathering if you're in close proximity to people and you're not wearing a mask. The current trend is we see one case that comes from a household, and then we tell people to quarantine, and whether or not they're actually quarantining, or maybe they're not really able to properly quarantine because of the living conditions. To be clear, when we ask someone to isolate because they've tested positive, the ideal situation would be that person is in their own bedroom, uses their own bathroom. That person does not leave their room to come to the kitchen to make dinner. They don't come and sit at the dining room table to have dinner with the family. They're isolated. And then everyone else that's been named as a contact in that house would quarantine together, but away from that person. So we know is not always feasible given someone's living conditions. And I think that's a lot of what we're seeing most recently.
Okay, thank you. Can either of you give us a rundown of where people can go to get tests locally?
I've got that info. So we mentioned earlier that we are testing at the Dorchester County Health Department. We're located at 3 Cedar Street, so that's right next to McDonald's. We have testing scheduled through September. It's every Monday and Wednesday from 9:30 to 12:30. I do have a couple of exceptions. So we are closed on Monday, September 7th for Labor Day. So there's no testing on that Monday. We have a Saturday testing on September 12th from 9:30 to 12:30, also at that 3 Cedar Street location. And then on Wednesday, September 30th, instead of the morning hours, we're doing evening hours, 3:30 to 6:30 p.m. So that's where we are testing. When you come to one of our testing events, you don't need to register online. You don't need to have an appointment. You don't need to have insurance. You don't need to bring an ID. You don't need a doctor's slip. You simply just come. And you don't have to come early to get in line. So anyone who shows up between that time frame that we're testing will receive a test. We're not going to run out of test kits. Our testing events are weather permitting, so I would recommend giving a follow to our Facebook page. It's Dorchester County Health Department Emergency Preparedness, or go to dorchesterhealth.org, where we'll post updates if we have to cancel for weather. We've had to do that recently with some of the rain that we've been getting. And, locally, urgent care centers as well as local doctors' offices are still able to offer testing. I'm not sure about their supply chain at this point in time, but certainly they are still doing testing. Additionally, the University of Maryland Medical System is offering testing at the Y Mills campus up in Queen Anne's County, and that's on Mondays and Wednesdays from 8:30 to 12:30. You do need an appointment for that. So if you go to coronavirus.maryland.gov, it shows you a map of where all of the active testing locations are across the state. So I know there's a number of pharmacies that are testing in other counties. But I will say our testing events are pretty well attended. We have anywhere from 150 to 300 people on a regular basis coming through in that 3-hour time span.
And is there a charge for the testing?
It is absolutely free.
Okay, thank you. Roger, you mentioned earlier that there were some businesses where that had gotten complaints made against them about the failure of their staff to wear masks that don't appear to have changed their behavior. Are you able to identify them in order to help protect people who might not want to go into their businesses?
We will never out a business who's not quite. The only way you'll ever see a business outed will be is if they do not cooperate, if they're given a 3-day letter for a plan of correction and they don't correct it, and then I will have to issue an order for an unsafe business. That'll be the only time you will be aware of that. It's no different than what we do with our restaurants and our licensing and our inspections. It's not our response. We did not break confidence with our businesses in the community. So it's up to each individual. Some folks can walk into a business and they can see whether or not they're doing what they should be doing. What the success thus far, the ones we've seen, the ones I referenced earlier, my food service manager has been out. She's given where they weren't wearing facial coverings. She looked at their policies and procedures. She gave them a checklist, said, I'm coming back in 3 days, unannounced, and she's gone back and they're wearing the facial coverings. It's going to be like one of our businesses the other day that we had a complaint about, and we had a staff member go over and go to that business and check it out while they were out. And the policy that we had been told that they were no longer wearing face coverings was non-existent, at least the staff that was there. The person in question that we maybe need to talk to and still talk to is the business owner, as to whether or not that person is on board with wearing facial coverings. But at the point they went in, the staff were doing the right thing. They had the social distancing, the markers. They were having their customers wear face coverings. And when you come into a business and you're not wearing a face covering, the responsibility to make sure it happens is the owner and or the manager of the staff that's on duty. So we'll protect our businesses, but we want them to do the right thing and help us and help protect our general population. It's not just about them, it's about the citizens of Dorchester County. So the other thing, if I could digress a moment on our testing, we think it must be marketed well, Dr. Scott, because you remember that we did a community testing here in an area of Cambridge, and I was told, well, we had people from Talbot County found us at that testing site as well. And it was not at the health department. It was at a part of this community. So Angela and my group, what she does with the JIC and our Facebook page, they know we're testing and they come find us because we are unique. I think the other jurisdictions, I'm currently the interim health officer in Caroline, and we have testing on Tuesdays and Thursdays by appointment. We will take folks from out of county, but we don't see as many out of county there as I see here in Dorchester. We're doing a lot of testing for a lot of folks, and we want to be business friendly with our customers, and we want to be available to them. So,
well, thank you. We have almost filled up all of our time. We have 3 minutes left to give you closing remarks. Dr. Scott, is there anything we left out that you'd like to cover?
I want to say, I ended last time saying similar things, but I want to say thank you to the community members. I really think that Dorchester County is in a good spot, and I'm very encouraged when, I'm out in the community with my family and I see people complying with masks, and I see people washing their hands, and I see people doing their best to socially distance. And I just want to reiterate that we understand how much of an effort it takes to remember to grab your mask when you're leaving to go to work, right? That's not part of our normal routine, but it's part of our new normal. And it really does take all of us working together to get through this and come out stronger on the other side. I'm seeing that within our organization. I'm seeing that among community members, and I want to make sure that we keep moving in that right direction. So feel free to reach out to us. We're available by phone, email, Facebook. And I don't know if Angela is able to put some of our contact information up on the banner or not, but reach out. We're here to support you. And thank you very much for all you've done.
Well, we would like to thank our guests tonight, Roger Harrell and Dr.
Closing? Did I get a closing?
Yes, go ahead.
Thank you, Glenn. First and foremost, I want to thank you for being here this evening, for the work you do in the community. First, another thing that I want to thank the citizens of Dorchester County, because all in all, they will do the right thing. But we wouldn't be here tonight if it wasn't for the vision of Mike Starling, who decided to put this little station together with other folks years ago. It's a great community effort. Michael, we thank you. We thank you for bringing this to our community and especially giving us an opportunity to share what we do in public health on a given day. And hopefully after COVID-19, we can come back and talk about other great things that we do with smoking cessation and cardiovascular disease and eating 5 fruits and vegetables a day. So thank you, Glenna, for your commitment as well and the work that you're doing, and thank our community.
And thank you to our audience. We appreciate your attention, and we hope to bring you more community conversations.